Imagine you get up from sleep one day and you are unable to move your one side of the body and not able to speak. Or maybe you are in a party when you suddenly lose your balance and not able to get up because of loss of power in your one side of the body. This all indicate that you have got stroke, also known as cardiovascular accident. So now you might want to note down what I speak next. So a stroke is defined as a focal neurological deficit of abrupt onset which is lasting for greater than 24 hours and is manifested either as brain infarct or a hemorrhage. So now we have got four key points here. So it's focal neurological deficit, sudden onset vascular origin greater than 24 hours, which brings us to the various signs and symptoms of stroke, which includes number one, that is paralysis of one side of the body. This means that there is complete loss of power, or it can also lead to paresis, which is partial loss of power, which depends on the area involved. Then number two is inability to speak or slurred speech. It can also lead to jargon speech, which is again depending on the area which is involved during the stroke. And as I've told you already, that stroke is a focal neurological deficit. So the signs and symptoms depends on the area involved, and you will not be able to see all the signs in all the patients, but these two are the most important signs which are most commonly seen in all the patients. Now, various other signs and symptoms include number one, visual problems such as double vision or diplopia. It can also lead to loss of memory and inability to control bladder movements. Now moving on, we need to know how to prevent stroke, which brings us to the risk factors involved. Now these risk factors, they can be divided into two groups, namely high risk and low risk. The high risk factors include number one, hypertension. This hypertension is a very important cause, and it also includes isolated systolic hypertension. Then number second is diabetes mellitus. It also includes atrial fibrillation. Smoking, use of drugs like cocaine or amphetamines, and vasculitis. The low risk factors include number one, migraine, use of oral contraceptive pills, recent MI, that is a myocardial infarction, and a prosthetic heart valve. Now a stroke is classically defined for age greater than 40 years. For less than 40 years, there is a separate entity called stroke in young, whose risk factors additionally includes number one, protein C and protein S deficiency, number two, antithrombin 3 deficiency, number three, factor 5 lead-in, antiphospholipid syndrome, sickle cell anemia, and infections like syphilis, TB, that is tuberculosis, and thrombotic thrombocytopenic purpura. Now, why are these risk factors are known as risk factors that we'll see when we deal with pathophysiology? But before moving on, there is one more entity which is called as transient ischemic attack, also known as TIA. It differs from stroke in a way that both have a focal neurological deficit, both are of vascular origin. However, a TIA, it lasts for only couple of minutes to less than 24 hours. However, a stroke always lasts greater than 24 hours, and therefore it indicates an impending stroke. Now, how do you diagnose stroke? Well, first and foremost, we have to see for the signs of stroke, which can be remembered easily by the acronym FAST, FAST, where F stands for facial asymmetry, A stands for arm drift, S stands for speech abnormality, and T stands for time of onset. So as soon as the patient is identified as a case of stroke, an emergency non-contrast CT scan of head should be performed, and this is done to confirm infarct. However, most importantly, it is done to rule out any hemorrhage, any tumor, or any abscess, and this helps in determining a further line of management. Also, the following investigations should be done to identify the cause of stroke. To assess the cardiovascular system, we have to do blood pressure monitoring. Cardiac function is assessed by an echocardiography, and an ECG should be done. Also, by clinical examination, we have to find out the degree of neurological deficit and the vascular territory involved. We also have to find out the metabolic status of the patient by assessing the blood sugar, oxygen saturation, and renal functions. Now, these tests should be done like simultaneously. When you are examining the patient, someone should be withdrawing blood to do this test, someone should attach the pulse oximeter, because the time is very crucial in this stage. And the other metabolic status include like electrolyte status and cholesterol, like lipid profile and ovarian status, and various hematological parameters like complete blood count and coagulation profile. And this brings us to the end of signs and symptoms. We'll see what will happen in pathophysiology next.